thank you guys for joining us for another Health Truth Life video. We're glad you're here with us. We're glad to be here. So we got another really good topic we're going to go over. It's one that we think about a lot. A lot of people, it's a big part of their life, and it's a good thing. It should be something we all need to be taking part in. And that is going to be under activity. We're on number 2 down here, exercise. So
you had number 2 of activity, number 10 total. This is number 10
we're moving right along.
of 24 matrix concepts. A very vital one, right? Movement.
It is.
But exercise.
It's another one that affects so many things. You know, it has have a little quote here. It says, exercise not only changes your body, it changes your mind, your attitude, and your mood. So yeah, it's something that we can do that affects us in so many ways positively. So we're going to talk about that. And how vital it is and how we need to be getting out there and moving. Movement is so important.
Absolutely. Yeah.
So how you want to dig into it? Start?
Sure. I mean, I think just, when you see people that are sedentary and you get put in a sedentary either season of life or what have you, oftentimes your health will be more at risk of failing or going downward. The reason why is because you're not challenging your body, your skeleton, your muscles, but also your blood vessels, your heart, your lungs, and your brain. They all don't get as much stimulation.
I like this. A quote that's definitely related to what you just said. If it doesn't challenge you, it doesn't change you.
Okay.
You know, so growth comes from being challenged. So I love that. Physically challenged, you know, like you said, mentally too. We need to be constantly reading and challenging ourselves and thinking. And then, hitting the gym, whatever form of exercise, you enjoy. Getting to the point where you're challenged and kind of stressed and pushing your body or your mind past those limits brings about change and positive change.
Absolutely.
Yeah.
Absolutely. And I think that there's a component of, one, people can exercise some, a lot, or a little, I guess I'd say, but there's a balance that everybody needs with respect to movement. Many people who are younger, who may have genetic abilities that others don't have, they can exercise at higher degrees of intensity than, say, older people or those who aren't used to exercising as much. But everyone can and should be, I think, doing something to help, like you said, challenge them. And oftentimes when you look at exercising, like for example, lifting weights or doing resistance training, you're actually breaking down muscle during forms of exercise that allows you to then build back stronger and with more resilience. And the very fact of challenging yourself to the point of your muscular system or parts of your system breaking down means that you're able to then build back stronger. And so it's finding that balance, but certainly I think that a big component of exercise is getting on a somewhat of a consistent routine. First, if you're deconditioned and you haven't had and been doing exercising for, I'd say a while, weeks, months, or even years, start back slow. And I say start back.
It's challenging for some people to get started if they haven't done it for a while. So what I recommend with those people is definitely start back slow with what would be called zone 2 training. And let me just step back here just to kind of give some definitions. Heart rate ranges are very important to consider with respect to exercise. You've got basically everyone's got a maximum heart rate that they can target based on 220 minus their age. So for example, for me, I'm 50. So 220 minus my age is 170. So my maximum heart rate should be around 170 beats per minute. Now, if I was highly tuned, like a triathlete or a marathon runner or someone who's exercising at a high clip all the time, I may have a heart rate maximum that's higher than that. I'll say that the most that I usually get with my workouts, I've had a few times where I've worked out and heart rates have been in the 165, 166, and that's what would be called zone 5 training. But you have these zones of training. Zone 2 is basically about 0.6 times your maximum, your maximum heart rate. So 170 times 0.6 would be my my zone 2 training. And zone 2 training is kind of low-level aerobic, but also good for overall general fitness and some degree of fat loss.
Zone 3 is just above that, like 70 to 75% of your
So
maximum.
break it down before you keep going. Zone 2, what types of movement or exercise would you recommend?
Perfect. That would be kind of like a mildly brisk walk.
Okay.
Nothing too, you're still able to talk in complete sentences.
Okay.
You're not out of breath, but your heart rate would be running at a pace that's kind of, you know, you can feel that you're doing some work, but you can continue that activity
Right.
for a long period of time.
So for those people that are kind of discouraged or having a challenging time, those are the things
Start
that
with
they can
that.
do. Yeah, start with that, and yeah, you can definitely build from there. You know.
Absolutely,
Yeah.
absolutely. Because then the other components, the things that like we talk about in this sheet here that will be available below in the description, is like high intensity interval training, which a lot of people who are deconditioned, they're not ready for that right outside of the gate.
Is it ironic that it's hurt? There's something to that, right?
There is something. So explain what hurt, what you're saying.
Well, yeah, it's the high intensity resistance training, and it can be instrumental in providing the body with stimuli needed to combat stress, insulin resistance, and sarcopenia.
So sarcopenia is basically loss of muscle mass.
Okay.
And as we get older, why do we get sarcopenic? Because we lose anabolic hormones, testosterone and growth hormone in both men and women goes down, but also oftentimes we're not stressing ourselves enough to maintain muscle mass, or not getting enough protein, you know, in our diet to maintain lean muscle. So, and then when you get more sarcopenia, you're more risk for fracture, for fall, and for other things.
I just saw a little something. It's funny. A couple hours ago here, Mark Rober, he's a YouTuber. He was doing a video and he had a scene where he had his shirt off and like he's kind of jacked all of a sudden. So people are like, "Dude, what are you doing?"
Yeah.
He's like, "Well, I actually just started going to the gym like for real for the first time in my life." And he's like, "I realized I'm gonna be stressed in my life. Like, there's gonna be stress. Why not do a healthy, stressful thing to my body that makes it stronger?" You know, I thought that was an interesting way to put it. You know, he's like, because we can make a choice to do. You're gonna be stressed and have stuff going on. Why not do a healthy, you know, form of stressing your body that's gonna build muscle, that's gonna, you know, help you lose weight.
Absolutely.
I like this quote too. It says, "You can either suffer the pain of discipline or the pain of regret." So you can be, you know, suffer the pain of going through the discipline of working out. A lot of times it's, you know, you don't feel like it, you're not in the mood, you're not feeling it. And there's some, like, if it's high intensity and you're pushing yourself where there's a little bit of not bad pain, but good pain.
Right,
you know? Or you can suffer the pain of regret later where you're, you know, you're paying for not working out. And, you know, you're going to be stressed and have other issues from that, you know? So why not push yourself and have the positive benefits from it, you know?
Absolutely. I mean, exercise is kind of nature's antidepressant. There's good literature that in some studies they've kind of like compared exercise versus an antidepressant, and they found that exercise is as beneficial if done consistently as an antidepressant.
The
in
side
some
effects
cases
aren't quite as bad either.
Well, you can injure yourself with exercise, right? You know. But it's one of those things where certainly the side effects would be considered to be less, and the benefits are obviously so extensive, you know.
Oh my gosh.
So
well, you talk about that in this next paragraph, but the 3 primary benefits of an effective exercise routine include stress reduction, improvement in insulin sensitivity, and anabolic hormone production. And you have on here to aim for 3 to 4 days a week of exercise. Any more or less may dilute gains or recovery.
Right. And it's a great, like, again, everything has to be balanced. Like we had a patient call this week about, hey, what's your system? He asked me, what's my system with respect to what program do I put people on? I said, man, you know, it depends on the patient. So a 20-year-old who's getting 9 hours of sleep and eating really cleanly and not drinking alcohol and caffeine, and he's just wanting, you know, to be fit, he can probably work out 5 to 6 days a week. But if I do that to a 50-year-old, it's going to put him into the ground. So like a 50-year-old who's doing CrossFit 5 days a week, not sleeping well, drinking a lot of caffeine, drinking 10 to 15 drinks a week, alcohol-wise, and working 60 to 70 hours a week, and maybe has gone through, you know, some issues with his wife or what have you and kids,
He probably should consider not doing CrossFit 5 to 6 days a week,
Right.
because he may not get recovery, and those people can be put into significant either low cortisol or low hormone production. Those people can reduce their testosterone production in a man's case, but also same for ultra marathoners and those who do high level running, biking, swimming 5 6 days a week. If they're not getting good recovery, they can put themselves into insulin resistance or into components where their immune system kind of breaks down. So finding that balance is important with everybody, right?
Yeah. So I mean, you'd recommend that. Obviously, it's important if you're just starting out. Maybe get with a trainer, find someone that can assist you and help you, and come up with the right program that's best for you. Because it's so it's based on individual,
Individualized is the key.
Totally.
So there's some generalities, one of the main recommendations from many I guess trainers would be get about 150 minutes a week of exercise. And that's a good ballpark to start from. Then the question is, was that zone 2 training? Is that zone 4 training? Is it aerobic or anaerobic? And that's all nuanced with respect to the personal case and or the patient in front of you, because someone who's got chronic immune condition or dealing with a chronic ailment or dealing with high levels of stress, you don't want to put them through consistent high intensity interval training, but you do for zone 2 training would be great for those people doing 20 minutes walking every day or 5 6 days a week. That's going to help them. It's going to improve blood flow. It's going to improve cardiac and lung function and provide some degree of vitality. So
my story, my personal story, and having back issues, and there's a point where you're like, man, yes, some of it you need to push yourself and push through and overcome, but then some of it, there's people that have a genuine disability or can't push themselves to that point. So know your boundaries, and know you don't want to hurt yourself and stress yourself out more. So there was a friend of mine who's, I think it was his great-grandfather was turning 100. And that's a big deal, turning 100. You've obviously been doing something right, living well enough. And so he made this little flyer. It was really cool. And just to encourage people, because he got asked so much, what are you doing? How'd you live to be 100, And one of the main things he said was movement, exercise, keep moving. He said, if you can run. If you can't run, walk. If you can't walk, wiggle your toes. He was just keep moving. I'm like, that's so good. So don't believe lies that say if you have an injury or you're getting up there in age, you can't do something, because you can. There's always movement you can do.
That reminds me of one of my favorite patients at Vanderbilt. When I did my internship at Vanderbilt, I did an internal medicine rotation there, and the part about the wiggling toes just spoke to me. I had a patient, it was one of my favorite patients ever, and she had some significant health issues, was in the hospital for probably 45 days with a bunch of issues. Slowly, we kind of tweaked her back into getting out of the hospital. The point is, one day I walked in, it was 7 o'clock in the morning. She had the windows open, and she was in her bed doing leg lifts and she was just doing work. Wow. And I'm like, man, you were just awesome. The epitome of hope. And she's like, I'm just trusting and I have faith. And I said, well, hey, you keep moving like that and you're going to get out of this hospital. And the point is, that's a great point about do something,
there's always some movement we
can't
can
run,
do.
walk. If you can't walk, crawl, right? Or wiggle your toes.
Right.
I love that.
Find something you can do to keep moving, keep the blood pumping, and
absolutely.
Then you'll receive these benefits that we talked about.
No question. Yeah.
So it's really good. Arguably the most important result of exercise, especially high-intensity resistance training, is the anabolic hormone production that occurs as a result. Fast-twitch fibers get stimulated during HIRT, which in turn helps stimulate the production of human growth hormones and testosterone, both that are vital to men and women.
Right.
So you want to hit on that a little bit?
Sure. I think, and again, one of our big focuses is trying to get men in their middle age to make more testosterone. Why? Because it's now been shown that men are making less testosterone than ever, and that we probably make less than our fathers did, and our fathers probably made less than their fathers did. Diet, exercise, stress, mobility, all these things play a role into it, exposures and stuff. But strength training and resistance training does stimulate endogenous production of testosterone and growth hormone
in both men and women. And so for both men and women, you want to have adequate growth hormone production, which is actually it's made by our brain. And so to get that, you've got to have one, deep sleep. It's usually produced between the first few hours of sleep. But resistance training does help stimulate production of growth hormone, and that growth hormone then stimulates bone mass maintenance, muscle mass growth and maintenance, plus other degrees of vitality. And then when you talk about anabolic hormone production of a man and a woman, well, yes, that's also important for sexual function, muscle mass maintenance, feelings of vitality, all those things which are important to kind of to think about. So large muscle movements, large muscle resistance movements are what stimulate that production essentially. So you're talking squats, bench press, deadlifts, things that are moving large muscles, not like arm curls. That's not going to probably stimulate much testosterone production, but squats will. And so, there's evidence to show some of these things. And so,
Okay. So under this, you do have an example of an effective exercise routine, keeping it simple. Do you want to kind of go over that?
Yeah, sure. And again, there's many ways, and I don't want to speak for, I'm not a trainer, right? And so I'm just telling you what I've seen that works for me and for many others. This is kind of based on like a CrossFit type workout, which would be about a 10-minute warm-up, and then like a 15 to 20-minute strength session with respect to weights and or resistance.
That's the squats and
and then a 15 to 20-minute high-intensity type training routine, which would be more in your zone 4. So your heart rate would probably be in the 80 to 90% maximum off and on for 8 to 20 minutes.
And that could be hitting the treadmill hard and heavy, getting your heart rate up, or the
could be, well, that would be almost like you can do sprints that would get you into that. So that would not be treadmill. You'd be running at a high clip. It'd probably be more of that, like interval was more like start, stop kind of thing. And so again, you can see a trainer about that. You can have a class like Orange Theory or Fit 45 or CrossFit. They do high intensity type resistance training. Also, trainers can set you up for that. But yeah, it's like that 8 to 20 minute workout where you're in that zone 3-4 heart rate, which gets and borderlines in that anaerobic, where you're actually to the point where you're past where your oxygen is fueling everything. You're actually getting lactic acid buildup, which then is you're breaking down fibers and stuff.
Pushing it, you're up.
You are. And so that's why doing that every day, for a younger person, you could probably do that. But as an older person, you probably don't want to be doing that because you may get to the point of burning yourself out and lowering your good hormone production. So it's finding that balance and doing that in concert with a trainer, and or a provider, physician, together we can, kind of help with that, and many others can as well.
Yeah.
But then also trial and error. What works for you? If you're working out too much, you're going to know. Why? Because for 3 days, you're going to feel like you can't do anything. Then you probably overdid it,
Yeah.
So, finding that balance is always important.
We talked about it earlier. It relieves stress, it's supposed to. And if you're causing yourself more stress by doing it, that's where you're like, okay, we got to take a step back and make some changes,
Yeah, and focusing on recovery. Recovery and sleep are huge.
Yeah.
Because you've got to have sleep to have that good hormone production and that recovery, that maintenance and or building of muscle.
Yeah. And then we haven't really hit on this yet, but diet and how that affects exercise. Man, it all just flows, because if you're neglecting your diet and eating super unhealthy, and you're not going to have the energy, and you're not going to see as positive of effects from it,
Right. And I will say that people that do start a program, whether it's a dietary or a strength training and a resistance training program, oftentimes they work together, because if you're starting a new program for exercise, you oftentimes start going, I'm going to want to start eating better because I know it's going to help provide a synergy in the benefits. And same vice versa. If you're starting an eating program change, then hey, you're probably going to want to start walking more and doing some more exercise. It's going to benefit both, and provide that synergy. Yeah.
So many benefits there for sure.
Absolutely.
So you got a little quote here at the bottom. It says, "I don't have time to exercise," many will exclaim, and I'll respond, "You don't have time to not exercise." So go on, get after it, and see the benefit of consistent high-intensity resistance training.
Yeah.
That's good.
I think that's certainly, and for some people it may be twice a week, right? Doing some resistance training and or interval training 2 to 3 times a week.
Yeah.
If they're at a point in life where 60, 70 hours a week, they're 50, 55.
Right.
But do something
Yeah,
to
just-
start. And then also do that zone 2 training that, you know, if you're saying 50, 55, that means a heart rate of around 100, 105. You're walking at a moderate clip. You're not out of breath, but doing that after meals or, 20 minutes during the day sometimes, that benefits you greatly. Not only does it increase your good, brain neurochemical production, but also improves insulin sensitivity, which lowers your risk of future diabetes.
So many benefits from it. So yeah, just encourage everybody. If you feel like you're stuck or you can't do it, yeah, you can. Like, just get out there. If it's starting with a walk, just a simple walk in your neighborhood and walk, a little more briskly and get your heart rate up, then yeah, start there and you'll build off it. But don't feel like you're stuck and you can't do anything. We had someone here earlier that was talking about pickleball, and he was like how many older people he's seen or people that are out of shape that have gotten into it. And it's such a fun way. Like, find something that's fun that you'll enjoy and that you can do with others too. It kind of building on the community thing, because he's having a blast doing this with 8 or 9 other people. Once or twice a week they meet up and do it.
Yeah.
So he's getting the exercise, he's getting the time with community and other people, and there's just releasing stress, and there's a lot of good benefits to build off of. So plenty of things you can find to do to exercise and to get moving.
Absolutely.
Yeah.
Thank you, guys. We'll have some more description, or in the description below, we'll have some more points to be made. We'll have a link to this matrix concept sheet for exercise. As always, thank you so much for listening. Please like and subscribe. We'd love to have y'all, clicking the button there. That certainly helps us and helps the channel. But again, thank you, and y'all have a great week.
Thank you. Appreciate it.